So the whole world seems to be freaking out about coronavirus right now, but there's particularly a lot of stress in my household because we think that my dad has coronavirus. He got back from Cuba 9 days ago, and a few days later, he got a sore throat. A few days later, he starts coughing and has a fever. We isolated him in the basement. My mom and I are sharing the house with him, and we have not shown any symptoms yet. We've both had a little bit of a dry throat, but nothing serious. But yeah, it's really scary right now. He went in to get tested on Friday, and they told us they would get us our test results 24 to 48 hours later. And here it is, over 72 hours later. We're at 75 hours later. We have not heard back from them. We have tried calling and left a message. Nothing yet. So we are just living in limbo. Yeah. It's kind of scary. We all knew that the coronavirus was coming. There was reports a month ago that 30 to 70% of Canadians were going to be infected with it, but you just don't think it's going to happen to you. And definitely we didn't think it was going to happen this quickly. Now, my dad's symptoms haven't progressed too much. We don't know for certain that he has it, but it looks that way. He's got a really bad cough. It got worse for many days. It seems to have leveled off. He's got the fever. He's getting sweats and chills at nighttime and during the day. He doesn't have shortness of breath. That's good, but it certainly would seem that he probably has it. So yeah, there's a lot of uncertainty right now. We're not well prepared for this thing at all. And I'm not used to being in this situation. I've got fibromyalgia, chronic pain, chronic fatigue, a lot of other comorbid conditions, but my parents are usually the ones who have been worrying about my health. And now I guess I'm getting a peek into their world, what their world has been like for many years, and just the uncertainty of it, and the helplessness that you feel. You want to do something, but you can't, and you have to stay away because I don't want to get it myself. I don't know how it would affect me or my mom, and yeah, we want to stay healthy, but this is really shitty. So I guess to end this off, I don't know what to say. Be safe, maintain social distance, practice social distancing. The shit is real, and this can happen to you. It will infect somebody you know. People are going to die. Yeah, anyways, I'm just trying to distract myself, trying to meditate. That's tough. But yeah, self care right now is the most important thing. My mom and I are just playing lots of board games, trying to keep ourselves occupied. Anyways, all right, it's March 18, 10:30 a.m. And I just want to give you a quick update on what has transpired since that last recording. It's been about 40 hours. And in the hours following that last recording, my dad's cough appeared to be worsening and continued to do so overnight into the morning. We were having family discussions about whether or not we should take him into the hospital to seek medical attention. Fortunately, his symptoms seem to be stabilizing a little bit. They are at least not getting worse. They're still relatively severe, but for now he's staying home, and we're hoping that that continues and that they continue not to get any worse. So yeah, here's to hoping that that happens. Another little scare yesterday as well. In the morning, I started developing a very sore throat, scratchy throat. I started to cough a whole bunch. And I started quarantining myself in my bedroom and the office that I'm currently in right now. Again, that fortunately a couple of hours later, that completely went away. So I don't know if this is just all in my head or if it's from the winter dry air. No longer quarantining myself away from my mom. And yeah, that's where we're at right now. So hopefully I've got more positive news to share with you all soon. Just in the meantime as well, I would like to take a moment just to thank everyone who continues to work during this time to provide essential services for the rest of us. So the doctors and nurses who are putting themselves at risk to help provide their services, grocery store employees, pharmacists, anybody who works for public transit. Thank you very much for everything that you're doing for us during this chaotic time. It means a lot to all of us. So yeah, I will try and provide more updates soon. I hope everybody is staying safe out there. And if you have any experiences that you'd like to share or just talking about your coping strategies, you can post about it in the comments below. I'd love to hear how everybody is doing.